So we're still talking about the surgical infections. This is the first section in which we'll talk about the history of surgical infections and the microbiology, that is the most common microbes involved in the surgical site infections. This section has been divided into the history in itself, in which we'll see how we came upon the techniques we use in surgery today. Then we'll talk about the advances in control of infection during surgery, and finally we'll talk about the microbes that are causing these various surgical infections. So let's start with the history itself. So we know the Egyptians had some concept of infection. So they prevented putrefaction by mummification. They utilized this concept and applied it to the prevention of putrefaction by the process of mummification. It is also known that they used to have slaves present, and these slaves were there to prevent infection from happening to the body. However, the slaves had no control, but they tried to stop it with the help of slaves even, and they were the first civilization to use antiseptics to prevent the infection in itself. Then after Egyptians, we know the Greeks were very well read in the prophylaxis. Hippocrates is known as the father of medicine. He proposed the use of antimicrobials like vinegar and wine. There were also various studies, various principles during this era that started the drainage of pus from the wound. The Greeks, they were the pioneers of drainage of the wounds. That is, whenever they saw or they had a patient with a purulent wound, they tried to drain it so that the wound might heal. During the Roman civilization, we had a very famous medic known as Galen. Now, Galen suggested that suppuration, that the production of pus, aided in the recovery. What he meant actually was that you need to remove the suppuration, and this removal of suppuration aided in the recovery. The concept of suppuration aided in recovery, it was widely misunderstood well into the Middle Ages, and the physicians during the Middle Ages would apply dung and even feces to a clean wound so that suppuration might occur in the wound. They thought it might help in recovery. Now, the French physicians were the first who suggested clean wounds, when closed, primarily healed without suppuration. They were the first to propose that a wound should be kept clean and should be closed primarily, and this was the best method to close a wound, and suppuration was not necessary in wound healing. Now let's move on to the 19th century. In 19th century, we had the Koch's postulates. So with Koch's postulates, they shed light on the microbes. He gave us an idea of how a disease process takes place. He gave the postulates with the culprits, in which the culprits were the details of the culprits were given. We were told of microbes being present, then the microbes causing various diseases. Then the isolation of microbes could be done, and inoculation of these microbes into a healthy individual might produce the disease again. Now moving on, Louis Pasteur gave the germ theory. According to Pasteur's germ theory, microbes were the cause of diseases, and diseases were not caused spontaneously. Now, Joseph Lister was the first medic to treat compound fractures with antiseptics, and this was the start of the antiseptic era in medicine. Now, the magic bullet was the discovery of the sulfonamide chemotherapy. So the discovery of this sulfonamide chemotherapy in the early 1920s was the magic bullet. With the help of this chemotherapy, millions and millions of patients were saved. Now we have progressed to use of antibiotics for prophylaxis even. So we give antibiotics prophylactically so that a patient might not develop diseases. However, misuse of antibiotics have produced a lot of antibiotic resistance in today's scenario. So, talking about the advances in control of infection in surgery, the aseptic operating theatre technique have enhanced the use of antiseptics. So we cover ourselves, we drape our patient, we use antiseptics. We clean and sterilize our environment, the air is filtered. So we do whatever we can to improve or to reduce the chances of infection post-surgically. Antibiotics have reduced the post-operative infection rates after elective and emergency surgeries. So we give a second generation cephalosporin, most commonly in GI surgeries. This is given to prevent post-operative infections. Now, delayed primary or secondary closure remains useful in heavily contaminated wounds. So, in heavily contaminated wounds, still the method of choice of closure is delayed primary, that is the tertiary closure, or the secondary closure, in which the wound is allowed to remain open and heal itself with the help of granulation tissue. Now let's talk about various organisms that are responsible for causing these surgical site infections. First of all, we have the Streptococci. So they form lines. These are small rounded bacteria which form linear patterns. So they form chains and they're gram positive. So the most important amongst them is beta hemolytic Streptococcus. It commonly resides in the pharynx. So group A Streptococcus is also known as Streptococcus pyogenes. It spreads, it causes cellulitis and causes destruction through the release of enzymes. So if it is spread, it can cause cellulitis. Now we have Streptococcus faecalis. It is an enterococcus that is present in the gut. It has Lancefield group D. It is found in synergy with other organisms as are gamma hemolytic streptococcus and peptostreptococcus. So it is also always found in synergy with other organisms, and it is an enterococcus that is present within the gut. Now, all streptococcus cocci, they are still sensitive to penicillin and erythromycin. The cephalosporins are a suitable alternative in patients who are allergic to penicillins. So first line of treatment are penicillins or tetracyclines. So if a patient is allergic to penicillin, you can always use a suitable cephalosporin. So moving on, we have Staphylococcus. They form clumps and are gram positive. Here you can see the clumps of cells, and they are also gram positive. Now Staphylococcus aureus is the most important member. It is found in the nasopharynx, that is the nasal cavities and the pharynx. The nasopharynx, the upper part of the pharynx, it causes suppuration in wound, hence the cause of pus in most of the wounds, and also around the implanted prosthesis. So it has an affiliation for the implanted prosthesis and can be found around or on them. Some strains, they are resistant to many common antibiotics. So it is an antibiotic resistant bacteria. Now we have Staphylococcus epidermidis. Now Staphylococcus epidermidis is a coagulase negative Staphylococcus. It is non-pathogenic commensal organism which is present on the skin. So it is present amongst other flora on the skin itself, and it is a non-pathogenic commensal. However, it is a major threat in vascular, orthopedic prosthetic surgery, and in indwelling vascular catheters and cannulas. So Usually it is a commensal, but when a break in skin occurs and there's contamination of the vascular compartment, that is the vascular structures, then there's contamination of the orthopedic structures, the prosthesis, it can be very dangerous for them, and can also seed the indwelling vascular cannulas as well as the catheters. Now, moving on, we have the Clostridia. So, Clostridia are gram-positive, obligate anaerobes. That is, they do not require, they cannot survive in oxygen. They require absence of oxygen for their survival. They produce very resistant spores, and these spores are responsible for the production of diseases. Now we have Clostridium perfringens. Now Clostridium perfringens, it causes gas gangrene. Now we have Clostridium tetani, the spores of which cause tetanus. These spores are usually present widely, they are disseminated widely in the soil, and from the soil they are implanted in an open wound, and from there they can produce Clostridium. They can produce tetanus in the patient. Then we have Clostridium difficile. Now Clostridium difficile also responsible for the production of pseudomembranous colitis. So these are the three important Clostridia species which produce various diseases in humans. Now moving on to the fourth important group, which is the aerobic gram-negative bacilli. Here you can see bacilli are elongated bacteria. So these are aerobic, these are gram-negative, and they are bacilli. They're normal inhabitants of the large bowel. So in the large gut, they are normal commensals. Escherichia coli and Klebsiella species, these are the lactose fermenters. So with the help of these bacteria, there's fermentation of lactose in the gut. Protease is a non-lactose fermenting aerobic gram-negative bacillus. They act in synergy with Bacteroides to cause severe systemic infection after severe surgical site infections after bowel operations. So they are responsible for the production of surgical site infections after various bowel operations, because they are present in the bowel. When bowel is manipulated, some of these bacteria, they come to lie on the surface, and from the surface they can now cause severe surgical site infection. Now, Escherichia coli is an important member. It is responsible for the urinary tract infection. Pseudomonas species are another important member. They colonize the burns and the tracheostomy wound and the urinary tract. So these are the areas which are susceptible to Pseudomonas species. Now moving on to Bacteroides. So what does Bacteroides do? It is a non-spore bearing strict anaerobe that colonizes large bowel, vagina and oropharynx. I know it can get a little bit dry, but these are some of the facts you need to remember, because these are the organisms that are found most commonly in surgical site infections. So knowing their habitat, knowing their properties will help you understand them and help to find the exact antibiotics that can use to kill them. So Bacteroides is a non-spore bearing strict anaerobe that colonizes large bowel, vagina and oropharynx. Now, important member is the Bacteroides fragilis. It acts in synergy with aerobic gram-negative bacilli to cause surgical site infections, as we have talked about before. It includes intra-abdominal abscesses after colorectal or gynecological surgery. It can also cause intra-abdominal abscesses. It is sensitive to imidazoles, example the metronidazole, and some cephalosporins, example cefotaxime. So if the sensitivity to imidazoles like metronidazole and cephalosporins like cefotaxime is important because these are the drugs that can be used to treat a Bacteroides infection. So this was all about this section. In this section, we talked about various microorganisms that were causing the surgical site infections. The importance of these organisms has been highlighted again and again. I'll advise you to remember those and the antibiotics that treat them so that you can assess and you can easily prescribe the medication to your patients. For further such sections, keep watching sqadia.com.